An emergency physician in Toronto is now calling on provincial governments to do something to address the crisis in emergency rooms across Canada. Dr. Catherine Varner says doctors and patients are now facing difficult summer months ahead. She says the capacity of emergency departments to provide care has been outstripped. Dr. Varner is in studio with us this morning. Great to have you here.
Thank you for having me today.
Listen, doctors like you don't take time often to sit down, write something like this, but that just speaks to me of how dire this situation is. Why has the pressure on emergency departments gotten to where it is, and why are you so worried about the summer?
So emergency departments in Canada have always been a safety net for both our healthcare system and our communities. And we've seen this safety net needing to expand more and more since the beginning of the pandemic. But the pressures in the emergency department now are primarily related to crowding in our hospitals. And we do not have the acute care capacity for hospitalized patients. And what happens is these patients are needing to board or stay for either hours or days in our emergency departments. And that means that we do not have the space to care for new patients who are arriving to the emergency department.
And why is that happening now? Why are we seeing more of that now?
This has always been a problem. For 20 years, the Canadian Association of Emergency Physicians has called for changes to address crowding. And now we are reaching a breaking point. And we saw this last summer. We know that in the summer, we see peaks of emergency department utilization, but those peaks are already on top of an overstretched and overcrowded system.
What do you want people to know about the kind of care they're going to receive if this continues this way in our emergency departments?
Emergency physicians across Canada, so from BC to Nova Scotia, have written open letters saying that we do not have the capacity to provide timely and safe care. And more, we're having to provide care in our waiting rooms, and that's just not acceptable.
What's the fix here? What needs to be done?
All healthcare systems and governments need to look at this as the crisis that it is.
And why do you think they're not? We've seen deaths in emergency rooms in the past year, or people waiting for care. We've heard doctors and nurses and patients all speaking out about this has got to change. Why hasn't it changed?
There is not one easy solution to addressing crowding in emergency departments because many aspects of the healthcare system are influencing what's happening in the emergency department. And the emergency department is really an epicenter for what we're seeing across the healthcare system of not having enough capacity, not having enough specialists, not having enough family physicians. And what we see on a routine basis is that these problems are coming to a head in emergency departments in Canada.
What's your concern if we don't change?
We will continue to provide care in unconventional spaces that are not safe for patients. Our emergency department providers, we want to focus on the sick patient in front of us, focusing on their airway, their breathing, and their circulation. And what we're seeing is that we have to focus first on where are we going to treat this patient, and that should not be the first step in our care.
Especially in a waiting room.
No.
Your article, you pointed to a few programs that are designed to address the pressures on the healthcare system. While well-intended, perhaps fall short of the root of the crisis. And those include programs that are designed to support emergency physicians in rural areas where we know, some of them are closing down. There's just not enough people to help. One in BC provides virtual on-demand clinical support. One in Ontario provides on-demand peer coaching. How do those help?
What I love about those programs is that the physicians who are receiving guidance from peers, the first thing that they hear on the phone is, how can I help? And when you're an emergency provider who is looking for help, seeking additional care for patients, that's what you need to hear. And so I think all of the measures that are being discussed widely right now should use that as a fundamental principle of how should I help serve the patients of Canada.
Are people working together on this system, doctor? Because it feels to me like the emergency room becomes this delta. People can't find a doctor, they can't get to the walk-in, they're sent to the emergency, and then we get this crowding issue. And suddenly there's pressure at the bottom. It is frightening as a patient. I can't imagine it as a physician wanting to provide the best care possible. Thank you for coming on today. Thank you for what you wrote.
Thank you, Anne-Marie.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.